Okay, Bismillahirrahmanirrahim. This is our part two of upper limb BCQs. Question number 11 is a 22-year-old man is diagnosed with metastatic malignant melanoma of the skin over the xiphoid process, which lymph nodes receive most of the lymph from this area and are therefore most likely to be involved in metastasis of the tumor. Now you are going to tell me the answer. Yes, the answer is D. That is axillary. Lymph from the skin on the anterior chest will primarily drains into the axillary lymph nodes. Question number 12. A 49-year-old man who had suffered a myocardial infarction must undergo a bypass graft procedure using the interthoracic artery, which vessel will most likely continue to supply blood to the anterior part of the upper intercostal spaces. Now the answer is C, that is posterior intercostal. The anterior intercostal arteries are 12 small arteries, 2 in each of the upper 6 intercostal arteries spaces are at the upper and lower borders. The upper artery has lying in each space in anastomosis with the posterior intercostal arteries, whereas the lower one usually joins the collateral branch of the posterior intercostal artery. The musculophrenic artery is a terminal branch of the internal thoracic artery, also known as the internal mammillary artery. The arteries can be interchangeably can used, so you should know the other name of that artery, and it supplies the pericardium, diaphragm, and muscles of the abdominal wall. It anastomoses with the deep circumflex iliac artery. The superior epigastric artery is the other terminal branch of the internal thoracic artery, and it supplies the diaphragm, peritoneum, and anterior abdominal wall, and it anastomoses with the inferior epigastric artery. The lateral thoracic artery, this is very important for the that which artery is joining the which arteries. Okay, now you can read it by yourself. Now talk about the question number 13. A 22-year-old woman is admitted to the emergency department in an unconscious state. The nurse takes a radial pulse to determine the heart rate of the patient. This pulse is felt lateral to which tendon? Now you can tell the tendon flexor carpi radialis. The location for palpation of the radial pulse is lateral to the tendon of flexor carpi radialis, as the radial artery can be compressed against the distal radius. The radial pulse can also be felt in the anatomical snuff box between the tendon of the extensor pollicis brevis and extensor pollicis longus muscle, where the radial artery can be compressed against the scaphoid. Now these three things are very important when we are talking about the radial artery or radial pulse. In the anatomical snuff box, the two muscles and the artery and the bone, scaphoid. Question number 14. Question number 14 is a 45-year-old man is admitted to the hospital after accidentally walking through a plate glass door in a bar in which while intoxicated. Physical examination shows multiple laceration to the upper limb with inability to flex the distal interphalangeal joints of the fourth and fifth digit. Which of the following muscle is most likely get affected? A. Flexor digitorum profundus. Now, why the flexor digitorum profundus muscle is dually innervated by the ulnar nerve to the medial two fingers and the median nerve for the long and index fingers. Because of the superficial course of the ulnar nerve, it is vulnerable to the laceration. Uh, such an injury would result in an ability to flex the distal interphalangeal joint of the fourth and fifth digit. Become the flexor digitorum profundus muscle is the only muscle that flexes the joint. Flexor digitorum superficialis innervated by the median median nerve only, and the course of this nerve runs deep to the usually affected by the laceration. Umbilicus function to flex the metaphalangeal joint and assist in extending the interphalangeal joint and trochlea, adduct and abut the fingers. Question 15 is a 25-year-old man is admitted with a wound to the palm of his hand. He cannot touch the pad of his index finger with his thumb but can grip a sheet of paper between all the fingers and has no loss of sensation on the skin of his hand. Which of the following nerves is most likely to get injured? That is D. Recurrent branch of the median nerve. The median recurrent branch of the median nerve is the motor to the muscles of the thenar eminence, which is an elevation caused by the adductor pollicis brevis, flexor pollicis brevis, and opponens pollicis muscles. If opponens pollicis is paralyzed, one cannot oppose the pad of the thumb to the pad of the other digits because this is the only muscle that can oppose the thumb by moving the first metacarpal on the trapezium. The recurrent branch does not have a cutaneous distribution. Holding a piece of paper between the fingers is a simple test of adduction of the fingers. These movements are controlled by the deep branch of the ulnar nerve that can be asked to you in your exam or your viva point of view. 16th question is a 55-year-old man is examined in a neighborhood clinic after receiving the blunt trauma to his right axilla in a fall. He has difficulty elevating the right arm above the level of his shoulder. Physical examination shows that the inferior angle of his right scapula protrudes more than the lower part of the left scapula. The right scapula protrudes far more when the patient pushes against the examiner's hand with the resistance. Which is the following is the which of the following neural structures has most likely been injured? That is B. Long thoracic nerve. The condition this patient is called winging of the scapula, and winging of the scapula occurs when the medial border of the scapula lifts off the chest wall when the patient pushes against resistance such as a vertical wall. The serratus anterior muscle holds the medial border of the scapula against the chest wall and is innervated by the long thoracic nerve. Serratus anterior helps in the abduction of the arm above the horizontal plane by rotating the scapula so that the glenoid fossa is directed more superiorly. Now comes to the question number 17. That is, a mother tugs violently on her 4-year boy to hand to pull him out of the way of an oncoming car, and the child screams in pain. Thereafter, it becomes obviously that the child cannot straighten his forearm at the elbow. When the child is seen in emergency department, radiographic examination reveals dislocation of the head of the radius. Which of the following ligament is most likely directly associated with this injury? That is annular ligament. Usually, annular ligament is usually asked in the exam. It is very important from the viva point of view as well. The annular ligament, it's a fibrous band that encircles the head of the radius in forming a collar that fuses with the radial lateral collateral ligament and articular capsule of the elbow. The annular ligament is the ligament. The annular ligament is a ligament. The annular ligament is a ligament. ये कहाँ पे थे हम लोग? The annular ligament functions to prevent displacement of the forehead of the radius from its socket. In a child, the head of the radius is almost in the same diameter as the shaft of the bone, so the head is relatively easy to dislocate. The joint capsule functions to allow free rotation of the jointed area. The radial collateral ligament extends from the lateral epicondyle to the margin to the radial notch of the ulnar, and annular ligament to the radius. Okay. Question number 18 is, after a forceps delivery on an infant boy, the baby presents with his upper left arm abducted, internally rotated and flexed at the wrist. The startle reflex is foreseen if it is not seen on the ipsilateral side. Which part of the brachial plexus was most likely injured during this difficult delivery? That is, answer is ventral rami of the upper trunk. The injury being described is also known as abduction paralysis, which is also known as vegetative paralysis, and irreversibly common. Relatively common in children after a difficult delivery. This usually takes from an injury to the upper trunk of the brachial plexus presenting with loss of abduction, flexion, and lateral rotation of the arm. Question number 19. A 35-year-old man has a small but painful tumor under the nail of his little finger. Which of the following nerve would be damaged, anesthetized for the patient's removal of the tumor? Which the common palmar digital of the nerve. Okay? Now comes to the C. Now the C part is the common palmar digital branch comes off the superficial branch of the ulnar and supplies the skin of the little finger and medial side of the ring finger. Superficial branch of the radial nerve provides cutaneous innervation to the radial dorsum of the hand and the radial 2.5 digits over the proximal phalanx. Now you can read the more explanation by yourself. Question number 12. The 36-year-old man is brought to the emergency department because of a deep wound on the medial side of his distal forearm. He is unable to hold a piece of paper between his fingers and has a sensory loss on the medial side of his hand and little finger. Which nerve is most likely to get damaged? Ulnar nerve. As it innervates the palmar interosseous, which adducts the finger. This is the movement that would maintain the paper between the fingers. The axillary nerve does not the axillary nerve does not innervate muscles of the hand. The median nerve supplies the first and second lumbricus. Opponents points to the plantar process brevis and flexor process brevis. None of the muscles none of the muscles would affect the ability to hold the piece of the hands.